When lupus starts attacking the kidneys, it's called lupus nephritis. Here's how doctors bring it under control. In lupus nephritis, the immune system forms clumps that settle in the kidney's tiny filters, causing inflammation and damage. Many people notice foamy urine, swelling in the ankles or face, or rising blood pressure. Others feel nothing at all. Doctors confirm the diagnosis with blood tests, urine tests, and a kidney biopsy that shows how much inflammation is present.
The biopsy is graded into classes 1 through 6.
Higher classes mean more active inflammation and need more intensive treatment. Treatment happens in 2 phases. Induction calms the flare over 3 to 6 months using strong immune-lowering medicines. Doctors commonly combine steroids with mycophenolate or cyclophosphamide and increasingly add belimumab or voclosporin for better control. Once inflammation quiets, maintenance therapy continues for years. Lower dose medicines keep the disease from coming back. Supportive treatments matter too. Blood pressure control, hydroxychloroquine, statins, and newer SGLT2 inhibitors that protect kidney function.
Regular checkups track urine protein,
Kidney function, blood pressure, and lupus activity. Visits stretch out as the disease stays quiet. Day-to-day habits also help. Low salt, sun protection, no smoking, gentle exercise, and avoiding over-the-counter painkillers like ibuprofen.
With planning, many people with lupus nephritis have healthy pregnancies. The disease should be stable for at least 6 months first.
There is no cure yet, but most people reach long-term remission and keep stable kidney function for decades with modern care. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.